to WhatsApp me. Welcome everybody as you're coming in. I know we have another minute before we start, but you are welcome. We have some broadband issues tonight, which I hope won't interfere with our delivery, but I'm mentioning that at this moment in time. So in another minute we'll start. Hi everyone, good evening. I hope you're all keeping well. If you're with us for the last 3 weeks, you're very welcome back tonight, and thank you for being with us for the last 3 weeks. If you're new to us this evening, you're very welcome, and I hope you get what you need from this webinar. The Marie Keating Foundation, together with Eddie and Sinead, who we've adopted into our family, would like to present a warm welcome to you also. Tonight is the finale of our 4-part webinar series for carers of those with cancer. We are signing off this evening on the importance of self-care. We have talked about looking after yourself throughout the series, but tonight it is our priority. This evening is very important to us, and it is to you also, as we look deeper into the meaning of self-care. Taking care of yourself is a valid goal, on its own even, and it helps you even more to support those you love and care for. Caregivers who pay attention to their own physical and emotional health are better able to handle the challenges of supporting someone else. So to date, we've acknowledged those of you who are carers for people in your lives with cancer, and we embrace support services to Care in Ireland through Family Carers Ireland, who we met on our first week. We have had a conversation with Deirdre from the Irish Hospice Foundation about preserving the self, and an informed discussion on the benefits of early palliative care, and we've even talked about end of life and planning for that. The mission of the Irish Hospice Foundation being that no one will face death or bereavement without the care and support they need. Remember, this is for both you as a carer and your loved one as the person being cared for. Last week we heard from Phil, our very own Marie Keating nurse, talking to us about how it really feels to be a carer, wearing many hats and the array of mixed emotions expressed: privilege, exhaustion, limitations, uncertainty, but the happiness in being able to do this. Some of these words continue to resonate with me throughout the whole series. Caring can be a blessing or it can be a curse. Receiving palliative care does not necessarily mean you are dying, but if you don't connect, you could be left feeling like you're dying unprepared, maybe with inadequate pain or control, and little advanced care planning. So we need to remember that we need to prepare ourselves well and look after ourselves well and those we care for. In the end, it is not the years in your life that count, it's the life in your years. So all 4 series have been hosted by Eddie, and thank you, Eddie, for being with us as a healthcare professional, a clinical psychologist, but also sharing your own experience of living and caring for your wife, Carl. So that has been very special. I think personal experiences are very important to share in this context. Cancer, we know, is a life-changing event, and it changes the way we think and feel in every aspect of life, and in those we care for also. It is good to remember, though, that there are a lot of people surviving cancer in Ireland. There are over 180,000 survivors of cancer in Ireland, and maybe surviving treatments, because often treatments can have very debilitating effects on people. So there are lots of survivorship programs in Ireland at the moment, and I'm very happy to say that the Marie Keating Foundation are currently running a program for people with cancer who have come out the other side, and they're dealing with uncertainties and lingering side effects. So that is running currently, but we also have a program starting on the 4th of November through to the 9th of December. And there are spaces available there still. So if you know of anybody that you think could benefit from the self-management program, please go to our events page and sign up for that. It's really encouraging news, isn't it, that there are many survivors in Ireland. And if we looked at survival rates for maybe men with prostate cancer, it's around 95%, and women with breast cancer, it looks at around 85%. So there's a lot of positiveness, but it is not an easy road, and I think we need to acknowledge that. So these programs do help people to develop skills and self-manage themselves to live their best lives. And that's why we're here tonight also, to help develop those skills for carers. Uncertainty is an overwhelming fear for both the person being cared for and the carer. So what we do, where do we go? What support services are available to us? The conversation is challenging, but we do hope in some way we have addressed some of these issues for you and have given you some direction and signposting to the support services you may require as a carer. And do remember too that Marie Keating Foundation is with you every step of the way. So I think my slides are stuck for the moment. Sorry, I just need to stop sharing and reshare. Okay, we're not moving on here. Just bear with us a second. I'd say we have some technical issues tonight that hopefully won't drown us. I'm sure they won't. Bernie, I don't know if you can help me there. If I could maybe stop share and you might be able to put up your own slides there.
I know, Helen, I don't know if you can hear me.
Just I'm not host, so Jen just needs to make me host and I can share the slides.
Done that now, Bernie?
Sorry about that. Yeah. Okay, we're getting there. Okay, thanks, Bernie. We need to go back to the introductory, the housekeeping slide there, Bernie, please.
It's just kind of frozen on me as well. Hang on now a minute.
Okay.
One of those
So
nights.
we're having.
You'll have to go without sides, eh? You just have to do.
Well, of course we can do that too, and we will do. So I think, like we've heard at the beginning that we were having some technical difficulties. All right, a lot of us are.
Yeah, there we go.
Okay, so housekeeping, of course, for webinars is extremely important, although I think most of us at this stage, throughout the whole COVID period, are very familiar now with the housekeeping rules for webinars. But again, a welcome to you all. You are in your own homes, so do make yourselves comfortable. Make sure you have a drink and that you can see and hear us. So as an attendee, you can't put your video on and you can't speak to us. But as a panelist, we can see and hear you. Sorry, we can't see, we can hear you. We can answer questions. This is a time for you, so we would really like you to put your phone away and give yourself this hour. So Jen is in the background trying to give as much IT support as you can in this difficult kind of time. Thank you, Jen, for that. Bernie is also in the background, and Bernie is our senior oncology nurse who will moderate the question and answer session. Now, this is important for this webinar as attendees. We would love you to participate as much as you can throughout the webinar. So you will see the Q&A button at the bottom of your screen. And if you click that, you will be able to type in a question, press the enter return key, and that question will come to us. If you're on Facebook, you can make a comment or ask a question, and we will receive that too. So it's really important as an attendee that if there's any questions that you would like to ask, any unanswered questions that maybe you haven't asked before, please use this as an opportunity to do that. The webinar itself is recorded, but really only for those who have attended. So it's a private recording for those who have attended tonight, and that will be available in the next couple of days. So if we move on to the next slide, and we'll just talk through the agenda. So we know that, so week one, we talked about acknowledging the role of the carer. And we had Family Carers Ireland with us, which was really informative. Week two, we talked about Deirdre from the Irish Hospice Foundation, as I've mentioned, preserving self. And then last week, we talked about compassion fatigue and building resilience and preventing burnout. And that was Phil, one of our nurses who, in fact, has looked after her mother and father through cancer, but also has a brother with cerebral palsy, and she's currently looking after as a carer and working as well. So lots of purpose in her life, with lots of, I suppose, constraints too. So, and this week we have Sinead, and Sinead, I'm not going to introduce you just yet, but I will do in a couple of minutes. I want to give you as much information as possible. So if we move on to the next slide there, Bernie. So when we think about the importance of self-care, we know that most people's lives have changed because of COVID. And again, we're now heading into difficult times where the numbers are increasing, and we're hearing it every day. Hospital beds are filling up, but we do need to keep in mind that this will pass. However, in relation to cancer and being a carer, the challenges continue and sometimes never go away. They can become overwhelming, and we must really embrace the importance of self-care. And some of these words you'll see on screen resonate very strongly with carers. So it's really important to think about strengthening your self-care muscle, making self-care a routine for you. Know which self-care works for you, and look at managing stress, but more importantly, recognizing it in the first place before you can manage it. Making time for self, and remembering always that you're not alone. You don't need to be alone. And very importantly, building family support and building friend support. There are also like many practical things outside of this that we can do and help ourselves with, and that is like having access to respite care and maybe knowing how to get that. And we talked about that in the Family Carers Ireland on the first week. Having access to equipment, educating yourself about the cancer, that your partner or your loved one has, knowing more about that and how it evolves and what happens with it and the treatments and side effect profiles. Having social support and always connecting with a medical social worker, and in-home support and counselling support. So they're all really important. We're still, though, as carers and as those surviving cancer and those in treatment for cancer, we're still protecting, we're still cocooning. We're dealing with disruption in the follow-up of appointments. We're communicating virtually as we're doing tonight. Sometimes we're allowing our loved ones to go it alone in a hospital setting. If they're being admitted, we're not in a position to be with them, and that can be very fearful. We're dealing with lockdown again, isolation, all the what ifs. So if we could look at the next slide, this is the introduction to Eddie anyway. So Eddie's been around with us for the last 4 weeks. Eddie's a clinical psychologist, as I said, and adjunct associate professor in UCD. Eddie is probably well known in Operation Transformation world, which again is a very well known and quite emotional journey for people during weight loss and obesity. So very, very difficult. So Eddie's with us tonight. Thank you, Eddie, for being here. And Eddie's going to, once I've stopped sharing my deck, Eddie will talk to us about the importance of self-care. Next slide, please. Bernie talks about respect, and the next slide, please. It talks about respect and confidentiality. So everything said in this group is confidential. During this hour, we may share feelings and experiences just as they are. There are no right or wrong statements. And the sharing that takes place in this room is a gift to everyone in the room. And what you choose to share is really very much appreciated. So next slide, please, Bernie. I'd like to introduce Dr. Sinead Lynch. Sinead has been with the foundation and supported the foundation for many years, and it's a real pleasure to know Sinead. Sinead wasn't a doctor when we met her first, but she's got there, and we're very proud of her. She is, like, as I said, part of our family. Sinead graduated in Trinity College, and she actually focused her doctorate on the emotional experience of having cancer. And has a very special interest in psycho-oncology. Sinead worked at St. Vincent's Hospital in the psycho-oncology department there, and is in the area of coping with cancer in her private practice. Sinead is also passionate about the cultivation of compassion and growth in empathy, not only for others, but for themselves too. And Sinead's other areas of interest is mindfulness. And I know we're going to learn more about mindfulness tonight and take away a skill that hopefully everybody will continue, throughout their lives, not only tonight, but throughout their lives. And Sinead has been on maternity leave, which for the last couple of years, is it, Sinead, or maybe 3 years?
Months, Helen, months.
You've got 2 lovely children. A 2-year-old son and Ava, who is, I don't know how many months old.
She's 3 months.
So, a very busy life, and Sinead and I were talking earlier, and she feels that self-care is even more important in her life now.
Yes.
So very important. So very welcome, Sinead. Thank you very much for being here with us this evening. So we're going to stop sharing our slides now, and we'll bring Eddie in there. Like the first few words from yourself, really, about the importance of self-care. What are the messages you'd like to get out there?
So before I get to that, Helen, I want to thank the Marie Keating Foundation, and I want to thank everybody who's joined us over the last 4 weeks. And if you're watching tonight on the Marie Keating Facebook page or my own Facebook page, we're looking really focusing now. This is the 4th session. And I suppose we've done a lot of digging, and we've gone into challenging spaces where we've looked at the different roles that carers played, and we looked at the whole area of self-compassion. We've also looked at how to protect ourselves from compassion fatigue, and the whole area of burnout, and how we manage our stress. And really, that's why we wanted to finish out today. And I'm delighted to be working with Sinead here tonight, because I'm really looking forward to on the importance of self-care, how self-care is so important for us. And so I'm going to start off with a challenge as well to you, if you're watching now. I'd like you to, we all know that self-care is important, but on a scale of 0 to 100, where would you rate how much effort you're putting into your own self-care as a carer? So where would you rate your effort from 0 to 100? We all know it's important, but how much effort are you putting in? And I did that exercise earlier on today, and I did it. And what we identified was that 50% of people are actively engaged in their self-care, but another 50% of people acknowledge that they could do better. And I was in that place too, that I could do better. And I think, so if I said to you, if you got a number where you've given yourself and rated yourself, what can you do by the end of this conversation, and can you do over the next couple of days to shift that score that you've given yourself up by 10? And one of the questions come in already, and if you have questions, put them in on the Marie Keating Facebook page or on the Zoom call here, and we'll address those questions. One of the questions is, what can I find to do during the day to give me moments of self-care? And I hope by the end of this call, and thanks for that question, that we'll be able to answer that in a very practical way. See, so self-care is really important. Self-care, if you think about it, when we go on a plane, and this is a story used a lot when I talk about self-care, is that self-care is you can't pour from an empty cup. That you, in a way, there's a lot of lovely phrases around this. You got to nourish yourself to support somebody else. And this is where this carers program is really focusing on the carers tonight. And how quite often carers get caught up in the doing. We're engaged in the doing. And I know that it's about the being. How can we be? And this is our challenge. How can we be? What allows us to be? And self-care is something that people have different styles of self-care. Some people's self-care can be active, and some people can be so a good way of thinking about active or passive self-care. Some people like a bit of both at different bits of time. Think about self-care as a menu. And it might be that you haven't tried something for a long time, or that something that hasn't worked for you before might work for you now. So for some people, their self-care can be a walk in nature. It can be, I found my tribe in sea swimming or in swimming. Or for some, a nice way of thinking about this is imagine pre-COVID, imagine those days pre-COVID, where you could be on holidays and you're on a beach. Are you the person that walks around that's looking in the trinket shop? Or are you able to sit and relax on the lilo on the beach? What type of person are you? Are you able to sit and relax? Or are you a walker and sort of checking out all the little trinket shops? So for me, and having a self-awareness is a good thing around this, is I'm a bit of a walker. I sort of like to walk around and look at trinket shops, and so I'm not that type of person that could sit all day by a pool and just read a book. I seem to be up and about. So that means I'm an active relaxer. That's really a good way of thinking about it. I need to be a little bit doing something active to relax. So before a call today, and this trying to identify that time in their day. It's really can be challenging. We two young boys, 12 and 10. One was out soccer training tonight. So and then the dog, and we tried to bring him out for a walk. So that was sort of how we fit the different tasks that we can do, and then make some of these tasks that are around self-care for us. And that's one of the challenges. That's what we're going to get in and talk about tonight, to really putting ourselves, and it's not selfish. Self-care is not selfish. Self-care is something that we do for ourselves to keep ourselves well. And when we keep ourselves well, it's a good role model too for the people in our lives that might be struggling, that may not be doing the level of self-care that they need to be doing. And sometimes you might share that self-care, or there could be self-care that the people do together. So there's just some initial thoughts on self-care, Helen. I mean, do you want me to continue with some more, or?
I'd probably like to hear maybe what Sinead thinks, actually, and we can just have a conversation around that, particularly as Sinead has two new babies now, and self-care has become so important. But the question is, do you have time for self-care?
Well, I think Eddie's challenge there was really good, because I think nearly even up to a week ago, I would have said I was maybe only putting in 20 or 30% effort into my own self-care. And then I kind of hit a wall and decided I really need to bring in practical tools. And when I say practical, similar to what Dr. Eddie is saying around the doing, I knew I needed to get out early in the morning before the day started and do my own 20-minute walk, or like that, spend a full 11 o'clock, time with a cup of coffee where I wasn't holding one or both children. So I started to actually make things happen in my day, and like that didn't feel guilty then if I was saying to my husband in the evening, I'm going to try and get back to having a Zoom class, whether it was exercise or friends chat or whatever it was. And again, just try to take that time without this motherly kind of guilt. So they were very practical steps that I just took in that area for myself. But I think
Sinead, one of the things that jumps out for me there is how people, I suppose we're trying to give a message out that having a compassionate way of talking to yourself when you step out from that, it can be very important.
And that was the next point I was going to make. It's exactly that, because you see, I think what I learned from, and I'm sure this will kind of, I don't mind sharing it, but the reason I returned to psychology after initially studying it was, my mom's journey through cancer, and sadly, like, losing her life to cancer, but it was through caring for her that I decided to return to study. But what I found was that people would have this attitude of, well, if I start to care for myself, I'm not being strong. And that whole area of vulnerability or seeing self-care as a weakness really sort of stuck out to me. And I guess later in life, when I then cared for a very close friend through his battle with cancer, I was able to bring in everything that I'd learned about the compassionate view that I took myself in. So it wasn't so much the doing anymore around going for walks. It was how I was talking to myself, like, you're doing great in this, you're really helping him, you can only do so much. So I just changed that kind of inner critic in my head. And that's what I would share tonight the most.
Very powerful thing. And I suppose another thing I want, the quickest win to self-care, and this is in a way, your life is being engineered very differently now, is sleep. And of course you can't get that sleep, but it's the quickest win, in terms of carers, the role that sleep and rest and recovery and relaxation can play a key role in that. In fact,
number one.
I'm amazed, and we've never met, but I'm amazed, and I'm also encouraged to know that you've a child of 3 months and you're able to sit here and talk about self-care. But that's a real powerful statement and it's a reminder too of the importance of self-care in all our lives.
Yeah, and you're right, because it wasn't that easy. I remember when Helen first said it to me, it was something that I jumped at, I wanted to do. And then I was trying to navigate, is this possible? Can I do this with a very small baby? And then I was like, of course I can, because I have support and I just need to lean in that support. And sure, look, if worst case scenario, I have to leave for 5 minutes, I know people would understand. But, you're right. It's the evidence of that sometimes we just need to step up and take that time for ourselves and not feel guilty.
And there's another reason thanks so much for bringing this wonderful point in about asking for help. Because sometimes, and we talked a little bit about roles at times, sometimes carers can play a role whereby there's a martyr role, that they want to do everything and that they're engaged in, and nobody can do it in a particular way only themselves. And then you talked about leaning in and asking for help. And it's challenging, but I think it's really important, because particularly around like practical aspects of care, such as lifts, such as medications, such as food and shopping and different planning in different parts of our life, so that so having some practical support, and then asking in a very direct way if you need some care in a particular area. People, I find, if you ask in a very direct way, I need you at this time to do this task, it's often more rather than generic, I need a bit of support.
Yes, completely. I don't know, Helen, if you want me to kind of continue on, but I suppose.
Sure. Yeah, no, please do, Sinead. Yeah.
Exactly on that, as you said, like that clear direction is so helpful to someone else, because when you're in the difficulty, like the outside, if people are saying, my God, she's going through so much, she's ill, how is she juggling, yada yada, they just want a clear instruction, as you said. but also it comes down to a self-awareness. What's stopping me from taking or asking for this support? And sometimes you begin to learn, oh, actually, there's a bit of a perfectionist in me. So it mightn't even be that, oh gosh, yeah, I have to carry this load or a martyrdom. It's just, I think I'm the only one who can do this right. Or, but she doesn't like, I remember with my mother, she hated how my father made scrambled eggs. I was the only one who could make the scrambled eggs, you know, and when she was so sick from chemo, I felt, well, I need to do that for her. But actually, if I let him try a different meal, I was helping my dad be of support to her in a way that I never knew he needed, you know? So it's about trying to step back then sometimes as well, because you're giving someone else an opportunity to.
And that gives me a thought around, and often in the world of parenting, we talk about how perfect parents can make very anxious children, and imperfect carers can be quite unhappy actually. And if we could aim, and if you're looking in tonight, if you can think about being good enough in work of psychology that we work in, we often want people just to be good enough, and good enough caring means being good, you know, it was stepping off the perfection space, stepping off the perfection, because there's no added value into that.
Yeah, yeah. And
one of the things I want to just reflect a little bit, I know, is that I want to maybe take some experiences out of the therapy room that people would have come and seen me over the years, and similar to yourself, no doubt, where quite often we've seen that person who's been crushed by the carer's role. It's the first time they've actually, because they've got so unwell in it, that they've had to reach out and get professional help. And rather than maybe getting some early and a sense that they had to do everything. I'm sure you've seen that in your practice.
Yeah.
Could you reflect some thoughts on that then?
Yeah. So just, I suppose you're saying that like they've come to the burnout stage nearly already, and that's when we're seeing them. Yeah. And I think for me, that's where that role of compassion comes in. And we talked earlier there about the doing and the practical things around taking time for a walk or tea or something. But I think for a lot of people, they say, but I hear you say be compassionate, Sinead, but I don't know what that really means, because if I did, maybe I would have done that earlier. And I suppose my sense of that is actually, yeah, we don't know how to do that. We don't know how to be.
So maybe we just talk, maybe just so someone can walk away now in understanding, what does that compassionate voice mean? So maybe if I just reflect a little bit on that, and you can reflect on it in a way. So quite often our inner voice is something that it can be in many different things. It can be coaching. It can be critical. It can be punitive. It can be negative. It can be, quite often what we find is people whose quality of life or their experience, their internal experience is negative. Quite often it's associated with a negative critical voice. And finding a nurturant voice or a coaching voice is, or a compassionate voice. And maybe you could give some examples of like, what would a compassionate voice versus a non-compassionate voice sound like in someone's head?
Yeah, well, I mean, I often say to people, try and visualize someone who used to give you a loving sentiment, or does give you a loving sentiment. So if it's something like, go easy on yourself, pet, or don't be so hard on yourself, or you're doing your best, or take it easy, darling. You know, it's a phrase that you'd probably actually use with someone else if you needed to say to them, like, go easy, you know, you're trying your best. This is really hard right now. So any phrase like that, it's the loving phrase, because compassion means, you know, suffering with. We forget that we're suffering as well. And so just suffering. I don't know what happened to Dr. Eddie there.
There's a dog in the room, I think.
Oh, okay.
Okay. Well, I'm actually going to put a comment to Sinead from one of the attendees there. During the whole COVID time, I worry a lot more about, as a carer, worry about my carer all the time. Any relaxing or mindful exercises that can be done regularly throughout the day to get rid of that knot in my stomach that is there all the time, worrying all the time. So it's real worry, constant worry.
One of the things that comes to mind there is, I know we'll get into later on, but it's a body scan, where a person would scan their body and they talk about that knot in their belly. And you know, I would encourage the breath as the first, your breath as the first protocol when it comes to self-soothing, when it comes to tuning down. That's a sense that knot in that person's stomach, that worry, and maybe trying to understand is it present? Is there times it's not there? Is it times that it might, you know, does it get, is it associated with COVID and the messaging and the news and the news cycle? Is it related to upcoming scans? Is it for their loved one? Is it embedded within this person themselves? Is it part of this shared cancer story, as it were, around repeat appointments or medication reviews? Is it around conversations that have not been had, that may need to be had? But somewhere in that understanding is also around this breath work. And I think a very good go-to around breath work is the breath in through the nose, to in for 5. So taking a nice deep breath in for 5, right into the abdomen, holding it for 5, and then out for 5. And try to practice that. And that go-to tool during the day. And when it's like the handbrake turn. If you only do that once, you won't get that. But if you just practice that breathing for a cycle of maybe 5, in for 5, hold for 5, out for 5, and hold for 5, and do that 5 times, you're bringing yourself into tuning yourself down. And I invite you to, in your head, as you're breathing in, you would say, this one is for me. And as you breathe out, this one is for you. And it reminds us that your first in-breath is for you to care, and the second one is for other people in your life. Would you like to say something on that?
Yeah, I was just going to add, that's definitely, and I'll do a sort of a mindful practice based on that sentiment later, but one that I find useful as well, just in the moment. So like you said, that very physical sensation in the belly, the breath, if you just breathe into it, straight away your body will relax through the oxygen. And then it will tell your mind to calm. It's like your autonomic nervous system will calm. But a great way also, in addition to doing the 5 in, the 5 out, if you breathe in for 4 and exhale for 8, if you can, it's really pushing it out. But you want to push out the carbon dioxide. So you want to get in the oxygen, which will help relax the body, but getting out the carbon dioxide will also relax the body. So you're getting into that knot that's in your stomach. As Dr. Eddie said, like, the thought in your head is worrying and it's taking you into the future, or bringing you somewhere else. But in that moment, if you just use the breath to anchor into the present, and let the oxygen and the carbon dioxide take a physical change in your body to reduce that anxiety.
And Sinead, would you like to take our viewer listener through maybe a grounding one as well, a grounding one where feet are on the ground? Would you talk through? So there's an alternative tool that they can use as well.
Sure. I mean, I guess people have this idea that, like, mindfulness or meditation has to be, sitting in a lotus position for 10 to 20 minutes, an hour. It doesn't. I would just say that any sort of awareness of breath in the moment brings you out of the stressed state that you might be in. So if you're feeling anxiety in the moment, just know that your body has the power to calm your mind, the same way your mind has just caused all this anxiety in your body. So
that's really, can I just stop you there, because that's so powerful. Like, just as your mind causes your body to trigger out the knot in the stomach, because it's the anxious thought that's driving the adrenaline flow and the stress hormones. And just to reflect that you can use now your body to do a soothing back on a back. Really powerful stuff, Sinead. Thanks so much. So keep going.
It's so empowering to know that actually that you have that vehicle. So your body is that that place that can just bring that relaxation about. So, you know, if it is a grounding, that, you know, you could actually take your shoes off and walk on the grass. You know, it's literally being grounded in the ground. It's taking the moment so that your mind isn't going into the future or maybe even going into the past. It's just staying where you are right now. And your breath has that power. So even if it's a grounding breath in, where it is just a full breath in through the nose and an exhale through the mouth. And even if that's only done at, 3 times, 1 inhale, 1 exhale, if you do that throughout your day, that's beneficial, and as beneficial as just taking some time to like meditate or sit down later. It's trying to build in those moments of awareness. So you're catching, okay, I'm worrying again now. Either my head's gone to something, or as Dr. Eddie says, it's been triggered because someone's mentioned pills or whatever it is. All I'm going to do is bring my awareness, try to keep my concentration on my in-breath, and then my concentration on my out breath. And that's a mindful moment, even if it's only 3 seconds. And again, that will change the physical sensation in your body.
Also, I just want to highlight to you some really powerful evidence around the role of, just going to take it up a little bit around the role of physical exercise, particularly on low mood and the impact on depression. And it's just one of the features for carers is that they may experience depression. And also that depression, which is like a profound sadness in a way, like whether or not you have the clinical diagnosis, but one of that profound sadness, it quite often can be, my needs can't be met because there's something bigger in the house here. And it's something, particularly it's my emotional needs. And what we know is that physical exercise, there's a massive study, the National Institute of Mental Health, over 10,000, look at the role of 40 minutes times 4 times a week of physical exercise can really impact on mild to moderate depression, really significantly. So, I mean, that type of, and again, I go back to that physical exercise, but there, and well-being and self-care are linked. And what would well-being look like for you? And I'm talking to you now as a carer. What does your well-being look like? What does it look like in the context of a life of pleasure, meaning, and engagement? What would that look like? And there's some really interesting look in when myself and Sinead, when we did our studies in psychology, we find that it's quite deficit. It's what's wrong here? What's wrong here? And only the last number of decades, we start asking, what keeps well people well? And this is equally as valid for people with cancer, their carers, or what about well-being? And well-being is often described as a life of pleasure, meaning, and engagement. Pleasure, meaning, and engagement. And what gives you, because I believe this is the dynamo to our self-care. It's sort of a self-perpetuated self-care if we have meaning and engagement in our life. And what gives you meaning and engagement in your life? So have a little think about this. I often think in the type of work that we do, Sinead, we pop in little seeds and we hope some of them germinate. What would you?
Yeah, definitely. And even like you said there, like in positive psychology, people think that being grateful or positive psychology is all a joke. But it has its strength because, you know, the fast track to happiness is gratitude. So even within your struggle, even within all the heartache and the difficulty around caring for someone that you love, try to find the things that you're grateful for, because even in that immediate appreciation grows. So I know that might sound like the hardest thing to do when you're struggling. And I know that if someone asked me at any point, like, how can you be grateful for things when it's so difficult? All I can say is that the first time around with my mom, I probably couldn't find anything to be grateful for. But once I had to care for someone else with cancer, I'd learned so much from the loss the first time that I was able to appreciate every moment that I had with this person, because the first loss had taught me so much. And it might sound like, how could I find anything to be grateful for after the heart-wrenching loss of a mother? But I found so much to be grateful for, and I found my purpose within that then. So just don't, maybe, as Dr. Eddie says, it's not all about the deficits in psychology. It's like what actually makes us happier, what gives us well-being, and gratitude is one of them.
We'll have to drop the doctor now at this point. Eddie's cool, okay?
Do I keep saying that? Sorry.
Yeah, we're all friends here, so we are. And gratefulness can be such the smallest things, and this is like whether it's a nice cool glass of water, whether it is that connection with nature, whether it is connection with family and friends, whether it is like you're holding your 3-month-old infant, like there's a piece of profound sort of connection there. So there is, there's nothing as pure as that, I don't think, in life actually. And so like being grateful, like that's a challenge for us. What can we be grateful for? And when we're challenged more, like it depends on our fuse. Our fuse as a carer can get shortened. It gets shortened because of the challenges that are faced in front of us. And I know that at times, when I'm hungry, when I'm tired, when I'm stressed, that's when my fuse gets shortened. So it is human nature of it.
Well, actually, you just reminded me of Maslow's pyramid, which, if people don't know, it's just a pyramid around like a hierarchy of what we need in life. And I suppose Maslow spoke about the bottom layer being food and shelter, and then when you've got that, you can move up, and it moves up into love and purpose, and it gets higher into this self-actualization, like who am I? But like if you don't have that first layer of food, shelter, sleep, you can forget about trying to find your purpose. You know what I mean? And I also really agree with that. Like when we're stressed, we're not sleeping. When we're not sleeping, we're irritable. When we're irritable, we get annoyed with ourselves and with those that we have to care for. So, even if you're taking the basics of saying to yourself, actually, yes, I'm going to start working on how I can get better sleep, or I'm going to start working on, eating better for myself so that I can use that analogy of, my own oxygen first before someone else. They're really important tools to practice every day. And like anything that takes practice, you do then start to just build them in. But in the beginning, because they're simple, people think, but that's just simple stuff. Sure, how could that nourish me? But actually, it is the simple stuff that really counts. And just to then be aware of, okay, how do I talk to myself? Am I a bit critical? Do I think I can't go out for a walk because I'm leaving my loved one who can't go out for a walk? Maybe he needs you to go out for a walk, as much as you need it. So I would remember those layers. If I don't have the basics, how can I,
really
can I just
important.
Can I just make a comment here, because something you've just said there, and it's a comment from one of our ladies on Facebook. And she said, as a patient, sometimes I just wanted to be left alone. So there's your opportunity to go for a walk.
Yes, and actually, Helen, you reminded me, because that's why I have someone else now in my life who's just been diagnosed, and I said I drew on the research that I did with you guys in the Marie Keating Foundation, and the amount of people who shared with me how, well, actually, sometimes I just wanted to be in a dark room on my own, or sometimes I wanted to just cry my eyes out about it all. I didn't want to have to be strong, or, so we project all these ideas of what we think someone else needs. Or like, as I said earlier, like I thought my mother needed eggs the way I did them, but I was depriving my father of stepping in and doing something else for her. So, sometimes we don't even realize these things.
Yeah.
But in a way, see what you're doing by doing it all. When we do it all, we de-skill others. That's the thing, and sometimes they don't get either the opportunity or the capacity to step up. And by sort of stepping back or stepping aside at some level, we're allowed people to stepping up. And there's the tyranny of being positive.
Sure. Yeah.
Listen, it's like just this tyranny of having to be positive and up all the time and for other people.
Mm-hmm.
And sometimes, like our emotional lives aren't like that. We come with warts and all. We experience love, joy, happiness, sadness, anger, fear, upset, gratefulness. We come with a whole wonderful collection of emotions.
Yeah.
But it's almost like we're not allowed to experience them either as a carer as well.
And I think that's why maybe mindfulness has become, you know, I do think it's still a bit of a buzzword. Like, I do prefer just being present or awareness maybe, but mindfulness, I suppose, has become popular because within the description of mindfulness is the non-judgmental aspect. So I'll be non-judgmental of the array of emotions, feelings, sensations, thoughts that I have. And so therefore I'm just allowing them to just be. And I think, as you said there, then you can allow the anger, the pissed off, the shit, you know, like I loved how, again, in my research, people said, I just wanted to be that. And I didn't want to have to just plow through. And so I think that's why when you can just allow yourself to just be, there are other moments when we can't. And maybe that's why if you're going through treatment that's particularly difficult, or if you're caring for someone that's going through it, sometimes you do need to distract. Sometimes you do need to just move on, and you can't be mindful in those moments. They're too difficult. But other times it's great to just have the non-judgmental, just being.
Yeah.
One of the bits there, just because I'm going to shout out to the carers here as well, is that, you know, sometimes people connect with you and they say, well, hello, how are you? And want to ask how you are. And then they're asking, how's your loved one? Which is lovely, right? But because if cancer wasn't in your life, you wouldn't be being asked about how you are in a way. And sometimes you just want to be asked about the football match, or you don't want this to be front and center in every interaction that's going on in your life. And that's a challenge as well, I think. You know, when it comes to like conversations, that we're not fully defined by being a carer, that we're not fully, it's not something that we possibly actively wanted. At some level, my circumstances might have thrown it into our lives in a way, but and we can accept it in a grateful way, but it's not something that maybe was a path that was chosen either. So I just think as a carer, my core message tonight, before we go in, and I want the other part of it too, is I want to talk a little bit just of an evidence base around the mindfulness bit, is that there's the Mindfulness-Based Stress Reduction Program. It's an MBSR program. It's probably the most evidence-based of all the mindfulness programs, 8-week program, that if you are going to commit to some mindfulness training or support, or it's a pretty good one. What would you think on that one today, just in terms of the MBSR?
Yeah, I suppose John Kabat-Zinn is the person who really brought mindfulness to the forum in terms of how we can use it in health and getting through pain and difficulties. And I just want to really stress that point, that sometimes we can't be mindful of what we're going through. And I think it's important just to say that, not as carers, but more so people who maybe have cancer. And that's why maybe people practice mindfulness after treatment. But as a carer, if you want to be practicing evidence-based mindfulness, then it is shown in scans of the brain, and just even in the chromosomes, that after 8 weeks there's a change. And basically, if you were to look at your chromosomes under a telescope, they're like a little shoelace, and the telomere at the end is less frayed after 8 weeks. And I suppose in medicine or psychology or anything, we're delighted with a piece of evidence that shows, actually, by being loving and kind, it's not fuddy-duddy, it's actually changing how our chromosomes and how our DNA are. And of course, if we're healthier there, we're going to be less stressed. So yes, the evidence is there for that. And like anything, 8 weeks will build it up into a practice.
Okay, I think I suppose at this point in time, we could start thinking about some mindfulness practice, Sinead. What do you think?
Yes, it's definitely the doing in terms of practice rather than talking about it.
Okay, well, we've 8 minutes left, so it would be lovely.
Yeah, okay.
We're all very much looking forward to, you know, just being led into it.
So I'm basically going to just do a very simple kind of mindfulness practice. I don't know for people how experienced they are or not. So again, I want you to even forget the word maybe mindfulness, and I just want you to take this time to just be aware and quiet with yourself, and just kind of take 8 minutes to just come home to yourself in this moment. So I invite you to just close your eyes if you like. It just helps you to maybe bring a focus inward. And this kind of meditation is based on Kristin Neff's compassionate view, and also something that Eddie said earlier about kind of breathing in for yourself and breathing out for the other. Kristin Neff is wonderful in the world of compassion. And she's someone that I kind of listen to again daily. You can do 5 minutes meditation. So what I hope that you take from this is just some space for yourself, and know that you don't have to use this method in meditation. You can just remember it and take it with you into your day. So maybe just becoming aware of your breath. In mindfulness, there is no right or wrong way to breathe, but maybe take a breath in through your nose and exhale through your mouth. And again, in through your nose and exhaling and inhaling and exhaling. And maybe you've noticed already how just 3 breaths can bring a sense of relaxation to your body. And yes, your mind will wander and you may have different thoughts, but in this practice, I want you to just try and stay with your breath at any point that you might get distracted. Breathing in and breathing out. And I just invite you now to call to mind a caring role that you take. So maybe a caregiving context. At any point today where you've been caring for another, whether it's a loved one or a patient or an elderly person, a young person, just a moment where you're now imagining caring for someone. And this is something that you do every day in real life, but we just want to call it to your mind's eye now. So you're just visualizing and imagining what that's like. And you might even get in touch with any stress or strain that immediately comes to mind. But I want you to invite all feelings. Again, mindfulness is non-judgmental. So even if some thoughts come to mind that you shouldn't be thinking, you feel you shouldn't be thinking, take away that judgment. Just let any feelings, sometimes anger can come up for us and we struggle with that. But caring is hard. So I'll say some words and I want you to just let them settle with you. Thinking of yourself in this carer role, I want you to just try and acknowledge that this is hard. You may wish for it to be different, but you're only human and there's only so much you can do. And of course you will help, but only when you can. So maybe focusing on your breath now, breathing in for yourself. Imagine inhaling all the goodness of oxygen and breathing out and letting go maybe of stress or strain. And breathing in again, I want you to maybe breathe in and visualize as if you're breathing in compassion or courage or calmness, whatever it is that you feel you need. Sometimes people like to visualize a loving presence or someone else loving in their life who can nearly energize them with this in-breath. Sometimes it's a glowing light. Just letting that healing warmth be your breath in and exhaling out. And now I want you to focus on the person you care for. And let them be your out breath. So with every out breath, you're going to bring compassion to them. Give them what they need. Recognize their suffering. And without getting lost in any thoughts around this, it's just an awareness that this is a hard time. So breathing in, compassion for yourself, and breathing out, compassion for them. Remember, compassion is suffering with. Breathing in, I'm not forgetting myself. Breathing out, I'm with the other person. And now I'm going to just invite you for the last minute or so to just bring them both together, to call to mind you and the other person in your circle of compassion, so that you're breathing in for you, and in your out breath, you're breathing out for them, knowing that love and compassion is endless, and there's enough for both of you. And so using those wisdom, those wise words, that this is so difficult. You're only human. There's only so much you can do. And you may wish for it to be different, but you will do as best you can. No judgment. Taking one last breath in and exhaling out. And when you're ready, opening your eyes and hopefully maybe feeling a difference for yourself. Thank you.
That was lovely, Sinead. I've experienced many of Sinead's mindfulness guidance on the Camino and in some of the programs we've run as well. So it's really nice, I think, to end our session in this way. And I hope that people have got huge value out of that skill in itself and will take it away. And as you said, it's about being present. Never mind mindfulness, but it's about being present with yourself and the person you love, who you're caring for. And I think before we close off, I really, there's just one thing I'd like to say, that one person caring for another represents life's greatest value. And I think we need to remember that as we go through life caring, because we're all carers at some point in time in our lives. So we're going to sign off. COVID is still here. And those of you who are caring for, your loved ones with cancer, it's still here. But we need to hold firm, and we need to stay safe and care for each other in this difficult time. And hopefully COVID will pass, we know that in time, but it will take time. And we also just acknowledge the work that you have done and the respect that gives you and those you love. Thank you.
Can I just say one thing before we go, Helen?
Sure.
Is that possible? I want to thank everybody for joining us for the 4-week series, and I want to thank Sinead for that really a level of deep and emotional 10 minutes of mindfulness, which shows you where you can go in just a small space of time, but a very powerful space as well. Some key messages I want to get out to carers and those that they're caring for is to get your flu vaccine. Okay, it's really critical that we get them early, and that that's going to be our first task in our own self-care, is that we go and get that flu vaccine. So we do, and for the same for those we're caring about. And this, to thank the Marie Keating Foundation for for bringing this together, for recognizing the importance that carers play in the role of supporting others, and that they, Marie Keating, stood up and were our supporters to the carers as well. So thank you very much.
Thank you. So I think we'll leave the meeting.